So that's why when you meet a little, like a newborn baby, they don't even really see you that well because their eyes are still developing. That's the interesting fact. But it takes about 2 full years, and then their eyesight is fully developed. And even you notice with babies, their eye color even changes. So you can't know exactly what your baby's eye color is going to be until they're probably closer to 2. That's just a thing. So what happens is our eyes continually grow rapidly from birth all the way up till around puberty. So around 2021, your eyes are growing in size. And then that's when the size of your eye stops growing. However, your eyes continue to increase in weight. Interesting, isn't it? So your eye continues to increase in weight, and as you age, undergo age-related changes. You know, nobody likes to hear that. Oh, age-related changes. What does that all mean? Well, we're going to find out. And these age-related changes can continue throughout your lifetime until you die. So our eyes can continue to change until we pass. So I want to ask you another question now. How many of you, what can you guess what the most common age-related change is with our eyes? The most common out of all the ones that we know of. Or you can think of, maybe you've noticed with your own eyes, things have changed. And you're like, I wonder if this is my age or if this is just something going on with my
cataracts, maybe.
Yeah, cataracts is a great answer because we definitely see a lot of that as we age. It seems like it's just part of normal aging, cataracts. But the one that I'm going for is presbyopia. Presbyopia. That's the formal name for when you start to have troubles reading close up. You know, when you have your paper or your book and you're trying to read it. This is pretty tiny what I've got here in front of me, and it's just blurry. So then, you know, you put the paper a little bit further away. Then you put the paper a little bit further away. And as your eyes are changing, you have to put until your paper is so far away, your arm is not long enough to hold the paper, right? That's the joke, right? Your arm's not long enough because you just can't see it. You have to keep pushing it further and further away from you. What happens as we age is the lens in the eye. We have a lens in the eye. It basically it's to do with the muscles around your eye, but your eye lens, the lens has troubles changing shape. So think of it kind of like the lens of your eye gets a little rusty. It's just harder to do the changing of the shape really quick. And when that happens, that's when it's harder for us to see close up. So you see in the picture here, you know, we compensate for not being able to see clearly by pushing the paper a little bit further away from us. Or, you know, some of us get like just the everyday, you know, from the grocery store or whatever, like readers, we call them readers, just so that it basically they're magnifying glass so we can see the close-up stuff. Now, I don't wear mine very often. I don't really have to, but are usually around 40, you're going to notice this change, this gradual decline in being able to see close up. That's what we call presbyopia. So what other things can happen with our eyes as we age? Well, the next one is tearing. We might have tearing. It's also called Epiphora. So it can happen in one eye or it can happen in both eyes. Why does this happen? Why does this happen to us when we are getting older? Well, it can happen for a few reasons. The one that comes to mind first is medications. Side effects from certain medications can cause this tearing in your eye. The other thing for us as we age is sensitivity. We become more sensitive to certain things like light, wind, changing in temperature. That's a big one. Changing in temperature. So to protect your eyes, the best thing you can do is wear covers, like wear sunglasses or wear something to protect your eyes. Now, here's the thing about tearing. It's pretty normal and it can be just the side effect. But if tearing persists in your eyes and you're noticing like one eye, like especially if it's like one eye, not the other eye, that you're getting this little tearing, and you're constantly, a little drip is falling out of your eye, and you're thinking, I'm not crying, why is this happening? And you're always constantly dabbing your face. Please get it checked out. Go to your doctor, go to the eye doctor, find out, because you might have an eye infection, or you could have a blockage in the tear duct. So very, very important to do that. But just know that it can be part of normal aging. For example, I had a learner in class a few weeks back, and she said that she never had tearing in her eyes except when she would go to bed at night. So she would be fine all day, and then she would come into her bedroom to go to bed, and she would get this tearing. And we discovered that it was likely that the house was all warmed up to a nice temperature, but she kept the bedroom cooler. So when she went from the living room into the bedroom, it was like a 8 to 10 degree difference in temperature, and that drop in temperature would cause her eye to tear up, which is one of the reasons, right? Light, wind, and temperature change. So keep that in mind. Be a little bit of your own detective if you're noticing something that's happening, that maybe it's because of something specific like that. So the next one is called dry eyes, and I always butcher the name when I say it. So basically dry eyes. We've all had this, our eyes dry, and we're totally constantly going like this. We're trying to get moisture into the eyes. This is very common, especially for women after menopause or during menopause, end up with like drier eyes. So what happens? You're itchy, is burning, I sometimes scratch my eyelid because my eye is like bugging me. But the problem with that is, well, one of the things is we don't even realize you can buy natural teardrops. You have to talk to your eye doctor, get the natural tears. So if you're having a particular dry eye day, just give yourself some relief and give your eyes a little bit of a drop. Now, this isn't a medication per se. You're not going to get addicted to something where your eyes aren't going to produce tears anymore. All it does is just gives your eyes a little bit of soothing treatment so that you don't feel so dry in the eyes. Now, also depends on where you live. Do you live in like Canada? Where I live, we have a lot of moisture in our air. This is not a problem for me here. However, do you live in Arizona? Do you live in Palm Springs? Are you in a dry climate? Yes, then your eyes are probably going to be drier. But just note that as we age, 50 plus, we tend to have drier eyes. What would your doctor give you for prescription? Maybe the natural eye drops, but also they might say, get a humidifier, the kind of little, not the air purifier that's expensive, but the little humidifier, the little frog or whatever, that you put in the baby's room, so that there would be moisture put in the air. Because when you're a baby, you don't know how to cough yet, right? You're not like, well, you can cry and cough, I suppose, but you haven't been taught how to clear your throat when you're younger. And so humidifiers helps to clear